Hello and welcome back to the series of staying healthy and preventing COVID-19 infection during the current pandemic. This is video 19 where we're going to discuss about why respiratory viral infections are most common during the winter period, especially in the northern hemisphere. So before addressing that, let's briefly look at about vitamin D itself, the basics. So, vitamin D is in fact a steroid hormone that affects every tissue in the body. Its receptors are present virtually every cell in the body, so showing that it has a important function in almost all cells in the body. So, vitamin D generated in the skin, at least for the 70 to 80% of the time, what we need vitamin D following exposure to the ultraviolet B rays in the sunlight. It controls over 5% of the human genome, with upregulating or downregulating. However, who are older, having darker skin, avoiding sun exposure, vegetarians, living in northern latitudes or even close to the equator because people will not go to sunshine, it's too hot, or taking certain medication like anti-epileptic or antiretroviral drugs, which causes increased catabolism of vitamin D, are at high risk of developing hypovitaminosis D. So, vitamin D deficiency markedly increases the risk of contracting coronaviruses, including COVID-19, and develop more complications and deaths as well. Those who are obese, for example, or overweight, has only 50% bioavailable vitamin D for them. The rest is sequestered in fatty tissues. Although this does not apply to tropical countries, respiratory illnesses such as influenza and coronaviruses are most common during the winter months. In fact, more than 95% of the patients with these disorders, cold and influenza, happen between end of November and early April of each year. The statistics of how many people are getting sick we discuss, and in the second and third videos of this series. There are specific reasons why such is happening during each winter time in these countries, locating far north from the equator in the northern hemisphere. So let's look at them. Because the sunlight during winter months does not have a capacity or effective UVB rays, the people in these regions are vast majority become vitamin D deficient with the low circulating 25 hydroxy vitamin D concentration. So with that, they are vulnerable to multiple disorders, especially for the coronavirus kind of respiratory disorders. So because they are vitamin D deficient, their ability to overcome viral infections are impaired. We will discuss actually in the next series with the reasons behind this immune impairment to fight against viruses during winter months. In addition, most viruses, especially respiratory viruses, live longer outside human bodies during cold climatic conditions. So combination make this favorable for the viruses to hang around longer and infect a lot more people. Especially when the sunlight and temperature are less, the viruses thrives. Another example is that the coronavirus, like SARS, has been shown to survive in the fridges, for example, or even the freezer for up to about a month. So the cold does not kill these viruses. So it also highlights the importance of sanitizing the food items you are bringing home during this epidemic, particularly, and to sterilize the bags and the food items, as we discussed in the video 9 in this series. So let's look at the effect of vitamin D on respiratory viral diseases in general. Data related to COVID-19 are still emerging, but suggest that the rate of infection and the mortality associated with the COVID-19 are inversely related to population serum 25-hydroxyvitamin D concentration. Because the population, because that's the kind of data we have rather than having individual data. When the population data is low, almost always the individual data are also low. Data from the previous coronavirus epidemic suggests that the infection rates, complications, and indeed the death rates are highest among those with the low serum 25-hydroxyvitamin D concentration. In fact, it has been shown that the worst in the people having 25-hydroxyvitamin D concentration less than 10 nanograms per mil, which is about 25 nanomoles per liter in different units. This level is, however, considered as a severe vitamin D deficiency. So you can imagine the people with a severe vitamin deficiency not only develop this complication and viruses, and also they develop other things like osteomalacia, proximal myopathy, depression, and many other avoidable disorders. So in addition, vitamin D has other immunomodulatory properties that includes downregulation of the host of pro-inflammatory cytokines. There are a large number of cytokines which cause inflammation. All this can be suppressed when you're having the adequate amount of vitamin D. With reference to coronaviruses, one of the most important functions of vitamin D is to control the renin-angiotensin hormonal system, which initiate almost all deaths following COVID-19 infection. Again, I will address this in a special video myself because such an important thing to understand and see what you can do all about it. The activated vitamin D, the calcitriol, is tightly involved in the regulation of this renin-angiotensin axis of hormones, not only one place, at multiple places. So abnormalities of this renin-angiotensin system lead to multiple chronic disorders also, including hypertension, pulmonary, cardiovascular, and chronic renal diseases. So you can see the important link between the renin-angiotensin system, hypovitaminosis D, and having these chronic disorders. So at the begin with the vitamin D suppresses the production of renin from angiotensinogen. So it's the first step of generating angiotensin. It's a very powerful vasoconstrictor and also act to release a lot of cytokines. So when the renin is less or suppressed, the production of angiotensin 1 is less. Therefore, the entire axis is now slowed down. So it is converted by the angiotensin conversion enzyme, what you call the ACE, and the raised level of ACE2, the second enzyme which convert or actually they cleave the angiotensin 2, also helpful, which is beneficial and productive in the presence of adequate vitamin D level. So vitamin D plays a delicate balance of maintaining of the regulation of the RAS or the renin-angiotensin system effectively. So it directly involved in the protecting human from especially acute lung injury and fighting against invading microbes, especially for respiratory viruses. For example, by vitamin D's subdue the lipopolysaccharide and viral mediated lung injuries and also prevent the development of acute respiratory distress syndrome, ARDS, usually the last step in causing death in people with pulmonary diseases, especially by coronaviruses. So beneficial effects of vitamin D doesn't end there, but it also helps in the people with asthma, chronic obstructive air diseases, etc., and their severity will be significantly reduced at the presence of adequate level of vitamin D in the body. So now you know a lot about vitamin D. In the next video, we are going to discuss a general aspect of vitamin D and the COVID-19, how they interact and what's the benefits and how vitamin D control the infection from COVID. So it is necessary to understand that these fundamental things so that the people will take serious the importance of these simple, freely available tools to protect themselves. So prior to going into the deeper aspect of the mechanisms of how vitamin D protect them and how COVID-19 causes severe illnesses and kill people. So let's look at the vitamin D, bit more function and the relation between vitamin D and COVID in the next video. Thank you. Have a great time. Bye.